Hello, everyone. Welcome. Nice to see everyone. Well, nice to see you, Alicia. I can't see everyone.
Likewise.
This video world that we live in. I'm Dr. Tiffany Mullen, the CEO and co-founder of Vital Health, and I'm really excited to have Dr. Alicia McCubbins, one of my OG doctors on the Vital Health platform. Dr. McCubbins is a naturopathic and functional medicine physician, practicing in all areas of functional medicine, but particularly, I would say, sort of hormones and fertility are maybe your top two. But you have a lot of experience in histamine and MCAS and a whole bunch of things we're going to talk about today. Thus, the reason that I have asked you to come back today to talk with our wonderful patients about this whole thing that's happening right now, which is springtime allergies.
That time of year again.
Yeah, that time of year. Those pollen bombs are hanging off of, well, they're not so much in my neighborhood, but they're starting to, appear around the country where people are like, oh yeah, allergies. And what we get a lot at this time of year is, what are some of the natural things that I can take so I don't have to necessarily take the pharmaceutical medications or the steroid nasal sprays, which are perfectly fine and safe, but some people want to do, the natural approaches. So first, welcome.
Nice to be here.
Yeah. And so maybe just talk us through a little bit, like what's going on when you have allergies, whether they're environmental, your dog, your dust, your pollen, what's happening when people develop these problems?
Right. I think it's a really interesting concept to think about outside of just even seasonal allergies. But yeah, this time of year, of course, we have more triggers. And
Yeah.
so when you're exposed to an antigen or specifically something like pollen or dog dander, what have you, you're going to release inflammatory hormones. This
Mhm.
body of ours is smart. It wants to come and like bring inflammation to an area to heal and fight, right?
Yeah.
Well, histamine being that one, and it's technically a hormone, so there's a lot of interesting intricacies in communication that happens just simply when histamine happens. It's
Yeah.
not just your body's going to try to fight it by having snot and rashes,
Yeah.
even though those are pretty good signs to listen to. But yeah, generally speaking, we're having an inflammatory response.
Yep. Yep. And one that's sort of misdirected, I would say, like more like I don't have seasonal allergies at all. And so for whatever reason, my massively messed up immune system doesn't react
Immune here too. Yep.
doesn't react to pollen. So there's something about my immune system's ability not to react to those triggers. Whereas somebody who has allergies, obviously, those little buggers bind to some kind of receptor, and then this whole process of inflammation that you talked about, leading to the real classic symptoms of allergies, which are really super annoying. Thankfully, in most cases, when it comes to environmental and seasonal things, it's not life threatening, but certainly allergies can be life threatening.
Yeah, and people often come with a different level of allergic responses, or of course they're going to show up a little bit differently symptomatically. But what I look at everyone like is, look, your body is a vessel,
Mhm.
and histamine has a cup, and not everyone's going to have these like major spillovers, and to the potential of anaphylaxis when you're really having a high histamine load.
Yeah.
But your cup is going to waver, and then sometimes the spillover is when we actually have more dramatic symptoms.
Yes.
So, yeah, I don't have seasonal allergies either, but I'm still highly affected by histamine in a
Yeah.
lot of different ways.
Yeah. Yeah. We're going to dig into some of that whole sort of spectrum of histamine related illnesses, I think, in this talk. But one of the things I think about too is the fact that you mentioned that histamine is a hormone and a neurotransmitter, which is really interesting. So can you talk a little bit about that? Like, what we tend to think of histamine as this sort of allergy related thing,
Right.
but what else does it do? Like, how else does it affect us in our bodies?
Well, one of the primary things that I see the most often because of my specialty more in hormone balancing and so on is that relationship with estrogen. A lot of people notice like they get random hives or they'll have more rashes or have more symptoms of PMS in that week or two before their period because of that huge relationship with estrogen peaking too. Um, there's other things where histamine can show up like musculoskeletally that again it's like inflammation, but we can see that affect joint pain and stuff as well. So
Yeah.
clinically speaking, one of the things I'm seeing the most that I see with histamine this time of year is an increase of anxiety and panic attacks.
right? It's a stimulating neurotransmitter, right? Am I getting
Yeah.
that right?
Yeah, yeah,
Yeah,
big time.
yeah,
A lot more on the anxiety side, but also, of course, because it's a neurotransmitter, it can affect us mentally, emotionally in many ways. But one of the things, like my last patient just before this call, was this fatigue is so intense, and I don't get why I'm so tired right now. And I was like, "Where are you?" And she's like, "I'm in Texas, and it's super dusty there." And she doesn't have allergies to dust, but that amount of, like
yeah.
processing and so on. Yeah, it's gotta be the histamine, and so sure enough, one of the things we're gonna talk about, quercetin is helpful for that.
Yeah. Yeah, so can you talk a little bit about testing for histamine? We can test for the neurotransmitter type of histamine in some of the panels that we do for urine neurotransmitters, but talk about how do you test when you're looking at histamine? And obviously we don't test everyone who has very clear seasonal allergies and things, but like when you're not sure where people are with respect to histamine, how do you evaluate that?
It's not something that necessarily test directly all the time, just because, like most neurotransmitters, they're fluctuating so
Yeah.
much throughout the day anyway. There is a blood test for histamine that I'll sometimes run for people when there's more of a complicated issue, which we'll
Hmm.
talk about a little bit too. But
Hmm.
no, most of the time I'm looking more into like, well, what could these triggers be?
Yeah.
So whether it's food sensitivities or allergies or more digestive stuff, we're looking more into like, where is that showing up for you?
Yeah, the root cause concept. Yeah,
Mhm.
getting upstream. So you mentioned, so one of the things that Alicia brings to the table that is particularly unique amongst all of the practitioners at Vital Health is she is a naturopathic physician, and I would say, and maybe this is not the right title to bestow you with, but in my mind, she is a master herbalist. She knows her plants. This woman knows her plants.
I
so
do. I do.
there are some great plant-based medicines that work quite well if one is considering a natural approach or would like to use an herbal approach to managing allergies. Maybe you can talk a little bit about that.
Yes, I get super jazzed about
I
this
know
stuff
you
because it's
do.
my hobby too, it's like, you gotta figure out a way to balance out, and you can never get enough plants because 'cause they're out there.
Yep.
And, this time of year is really interesting. Stinging nettles, wood nettles, they grow across most of the country in the springtime, and one of the most profound antihistamines we have. And
Yeah.
it's so cool because it's like, of course it's growing right now, it's the
Right.
first thing to pop up out of the ground.
Yes.
So certainly even drinking nettle tea, it tastes like leaves, but it's not strong, it's not gross, and you can complement it with some honey or whatever other flavor, but that alone can help people big time with allergies and, or histamine in general, but getting ahead of the season too, sometimes people notice they're gonna start drinking this tea, like, in January and have
Yeah.
bad
Yeah.
outcomes. Yeah.
Dial that histamine down. Yeah. Stinging. And it's funny because stinging nettle sounds like something that you would want to stay well away from. but
Oh,
it's actually just
no.
a great plant
It's
based.
so awesome. And
Yeah.
it does sting, but what's cool about that is if you start really looking into, like, the history of these herbs and how they were used by natives, right? Like, these medicines were at their disposal all the time. They would use that stinging nettle that has these little, like, needles, if you will, but that, like, go into your skin, and it causes almost like what feels like a histamine rash, right? Like, you get, like, these welts, and it, like, definitely stings, but it's healing in itself because of how the positive side of histamine works. People would use it on like rheumatoid arthritis type pain, literally use it for the pain,
Yeah.
but it was to heal.
Right.
So yeah, there's a lot of benefit to even the things that sound negative.
Yeah. So maybe instead of going and gathering your own stinging nettles, unless you're really good at it like you are, so that you don't get all
Love.
cooped up,
Yeah.
looking for products that have stinging nettles in them as part of your allergy approach. What are some of the other things that you use, maybe either herbally or sort of nutritionally to manage allergy symptoms?
Well, typically these like allergy formulas will have nettles as
Mhm.
well as vitamin C,
Yep.
great for the immune response, and bioflavonoids, which are basically, so flavonoids are kind of like antioxidants, right?
Yeah.
That live in really like colorful fruits and vegetables and stuff. So those are helpful for the vessels of your the lining of your blood vessels, and again helpful for um, mitigating some of the histamine response. But then quercetin
Mm.
definitely
Love
is
it.
one that I think is the shine. Yeah, that
Yeah.
one is the profound antihistamine in the sense that it's actually a mast cell inhibitor,
Mhm.
MAST, mast cells, and mast cells release histamine. So, when you can take a few different angles at chilling the histamine out, that's
Yeah.
why we do more than one thing at a time.
Yeah. Make those make like a complementary group of things. And I think most products that you can buy online that have, or in any dispensary that would have anti-allergy properties are going to probably, like you said, come at it from all different angles
Yeah.
and stabilize the mast cells as much as possible, and then deal with some of the other inflammatory mediators in the process.
Yeah.
Um, Anything else that you can think of that you'd want to talk about in terms of nutritional or herbal choices for
Sure.
patients?
Couple other herbs, goldenrod, which is
Yeah.
really more so in the fall. I like to pick it in the fall, and then I have it in the spring. Another one is feverfew. That one's often also incorporate. It looks like chamomile, actually,
Wow.
but it is incorporated in a lot of migraine formulas because migraines, histamine. There's a huge relationship there. Um, Nutritionally, there's a lot that you can think about. I mean, not only from an individual perspective of like mitigating what are you sensitive to, but also gut flora. I mean,
Yeah. Right.
if we're talking about probiotics, what specifically is right for you in that sense? Finding that balance of bacterial imbalance too. And then also, this is kind of a can of worms, and I don't love talking about. But the
But
low
we're gonna.
histamine diet is worth bringing up
Yeah.
and being aware of. If someone has a lot of histamine going on, if their cup is totally runneth over, having awareness around foods that are just naturally higher in histamine is good to know.
Yeah.
You
Yeah.
can't avoid it. You
Right.
can't like be histamine free.
Yeah.
But the things that are of highest histamine loads would be anything that's aged. So that includes your like healthy kombucha, fermented veggies like sauerkraut and so on, kefir, yogurt, blah, blah, blah. If those are causing a problem, but you're like, but it's probiotics, it's like, well,
Yeah. Right. Yeah.
you know.
Not
And then,
good.
of course, alcohol. Like, I think alcohol is the one that everyone forgets. Like, that is a histamine bomb, you know?
Damn it.
It's fermented, it's sugar. You're gonna like people like will say, "Oh, I don't know why I'm so flushed." It's like,
Yeah. Why is my face all red?
yeah,
Yeah. Yeah, that's true. So histamine is in foods. I think not everybody realizes that. The other thing that I've learned just from talking to patients is that foods naturally accumulate more histamine the longer they sit around. So the classic leftovers
yeah.
situation, where a food may
Mhm.
be not necessarily high in histamine, but you put it in the refrigerator and then 3 days later you're reheating it or whatever, that's going to
Yep.
be a higher histamine load. And if you're sensitive to that,
Right.
that might affect you. And you'd be like, well, I don't understand. This didn't bother me 3 days ago and I ate it.
Exactly.
Yeah,
Yep.
so that's a real classic kind of story. So, talk a little bit about something that other than avoiding, which obviously makes good sense, histamine containing foods. Are there other things that people can do if they notice that when they eat certain foods, they become more histaminic, flushed and
Sure.
runny nose and more dilated blood vessels or more tired or headaches or things like that? What are the other things that you could do to help with that?
I think the first thing I think about is more functionally as a
Yeah.
functional medicine provider. It's like, well, what is it that you're creating this immune response to? Is it the specific food or is it that you're not really breaking it down super well? That's more often than not the issue why people will have like kind of this response after eating. And it's just simply like your stomach isn't acidic enough. And if you're not
Yeah.
breaking down that food, there's a lot of different reasons to have a response, but that could be one of the bigger long-term goals of fixing that so that you don't have a response.
Absolutely. And there are supplements too, right, that you can take to help break down
Yeah,
histamine
sure.
after you eat it? Like, we'll talk a little bit about that.
Yeah, I usually start people at simple things like, okay, just digestive bitters, roots or plants that are naturally bitter have a taste response. So, like the taste buds tell your brain time to eat, and
Mhm.
so then that creates a better natural cascade of like your stomach makes more acid, your enzymes get released, and so on. But if those kinds of things, that or apple cider vinegar, aren't helpful before meals, then we do a capsule of hydrochloric acid. You don't want acid in your mouth, but you can definitely take it in a capsule to swallow, and
Yeah,
that kind of sets the stage for, like, breaking it down.
right, and we're not talking about levels of or hydrochloric acid that would, like, burn through your desk or we're talking about very
No.
low levels of betaine HCl, which is, a
Right.
common supplement in digestive products. And then there's also things like DAO, which I can't remember what that
Right,
stands for.
yeah.
What does DAO stand for again? I don't even remember.
Diamine oxidase?
Yeah, okay, that's where I was
Yeah.
gonna go, but that seemed too obvious, so okay, good.
Yeah,
I'm
no,
glad you
yeah.
remember. So that actually is a specific enzyme, right? That helps the
Mhm.
histamine once it's in your stomach or your digestive tract to kind of chop it up and get rid of it so it's not absorbed into the body.
Yeah, yeah,
Yeah.
totally.
Yeah.
It's not a
That's something
cheap
that I've used.
product and it's not widely available. There's not a ton of people making it,
Yep.
but there when people have tried and notice a profound difference, it's worth having it
Yeah,
on hand.
totally. Especially when they can't when it's harder for them to kind of monitor their diet,
Right.
circumstances being what they
Going
are.
out to eat,
Yeah,
so many more
exactly.
variables
Yeah.
there.
Yeah,
Yeah.
exactly. So, okay, so that's really helpful. So now let's pivot a little bit because as long as we're on the topic of histamine, I kind of want to talk a little bit about more severe histamine related problems because I think that they're a very common thing that, first of all, traditional medicine misses
Mhm.
broadly, and second of all, that patients suffer with and don't really understand very well. And where functional medicine I think does a great job of helping, and that's sort of the MCAS, mast
Right.
cell activation syndrome, that stands for spectrum. So talk a little bit about that and kind of how we look at that through a functional medicine lens.
Yeah, this is a super complicated topic because, I mean,
Yes.
even I in med school 15 years ago didn't have this training.
Yeah.
The idea of mast cells were usually talking about mastocytosis, right? Like cancer of the mast cells, which is super rare.
Yes.
Don't think
Never
I've
seen
ever
it.
seen it. No.
Yeah. Yeah.
So that of course is like what even the conventional doctors are like, oh no, this can't be mast cells. I even know immunologists, people who focus on histamine and immune and allergies and all that, completely dismiss this concept because
Yeah.
unfortunately the training wasn't there. And really, to be honest, like massive education that we have gotten has all been in the last 5 years.
Mm.
So
Mm.
mast cells
Thank you, COVID.
are yes, well, that's the thing. It's like this is very much pandemic centric, and I
Yes.
think it's helpful to know that it's been around before, but we have more that we've learned because of like the mass amount of people getting a similar virus. A post-viral presentation can look very different for a lot of people, regardless of COVID or not. Before COVID, mono was a very common issue to trigger stuff like this.
Mononucleosis
EB,
slash
yep,
Epstein-Barr virus, EBV. Yeah.
yep. So again, not new, but very easy to understand now when we see all these people who are dealing with lingering symptoms after a virus of any kind. Mast cells are important for coming to an area just the same way that histamine is to help heal. But in some of us, they get like they spiral. They just don't stop. They keep on going and going and going. And so then we have all this extra histamine too.
Yep.
And so that can show up in a lot of like very common ways, like where like many people will say, I have rashes, I have digestive issues, I have anxiety. Let's see. Those are the big ones, like where it's like, oh, that could be it.
Or
Um,
fatigue. I see a lot of
oh
fatigue, like
yeah,
really overwhelming fatigue, right?
for
That's sort of
sure.
almost chronic fatigue syndrome, which is a little
Yeah.
bit of an older term. It's almost like on that level.
Yeah. Yeah, and then there's a lot of, like, branches where this can
Yeah.
go, but there's a huge influence on the nervous system as well, and so a lot of people with mast cell issues may also have something called dysautonomia, which is that's a whole nother talk, but, they influence each other, and so my approach to these kinds of folks is difficult because our testing is not awesome.
Yeah.
This is where, like I said earlier, you can test histamine on blood work.
Mhm.
I would also test tryptase,
Mhm.
TRYPTASE, and those 2 things can be very helpful if they're positive, like
If
if
they're
they're high.
positive. Yeah, that's the thing. Yeah.
If they're normal, it does us nothing. It doesn't
Yeah.
rule it out.
Yeah.
And
Yeah.
so we're kind of in this sticky situation where oftentimes those 2 labs are expensive or not covered by insurance. And so honestly, a clinical approach is to just throw some antihistamines at it,
Yeah.
natural or not, to see if you
Yeah.
have improvement.
Absolutely. Yeah.
So
I think one of the most profound cases that I had as a functional medicine doctor early in my career was a person who had severe mast cell activation to the point where she had swelling, severe swelling, edema, we call that, um, really significant symptoms, very significantly fatigued. And it took her years she was a very persistent, very smart woman. And she actually ended up kind of figuring it out on her own and then found the nation's leading thinker on this problem. And
oh,
it
Dr.
was
Afrin
confirmed Dr.
probably.
Efron, yeah.
Yeah, yeah,
So
Tiffany,
she schooled
FRIN.
me on this whole thing. I've never seen as severe a case as she had, but I have seen obviously that opened my eyes to being able to recognize the less severe, more subtle versions of this, and certainly the COVID related ones have really come to the forefront, with that strong overlap with dysautonomia, which is this sort of nervous system presentation, which again is too big a topic to discuss here, but we'll have to kind of come back for that one.
Yeah, we will. Yeah.
So when should someone suspect that they may have a mast cell problem? Like how would a person who's not medical think of this issue? What would be some of the things that you think, okay, wait, this might be a mast cell problem?
Well, I think that the first the first thought is when you're not having a typical, like when you're having these unexplainable symptoms.
Yeah.
You're like, it has nothing to do with that. There's no pattern.
Yes.
It's or ever since, right? Ever since trauma, ever since illness, whatever. I think that's a big part of it.
Yep.
Um, and then it's hard to speak to that just because I'm like, there's so
So
much
many.
variability.
That's an unfair question, actually,
When
because
there's a
there is.
when there's like this chronic thing where you're really not seeing a pattern, I think that's where I often look there. I'm like, well, no one else is going to look there.
Yeah. No, it's true. It's true. I actually think of another patient who the only thing that she has is really significant disabilitating, like painful itchies, you
Yeah,
know? Yeah. And so that can be another thing where there isn't necessarily a observable skin
right.
rash,
Just
but
histamine.
within the body there are obviously, histamine that's triggering those itchy pains, you know? So yeah, anything that's sort of
My
outside the lab.
personal
Yeah.
So when I was first learning about this, I was having chronic hip pain, and I did figure out it was hypermobility and inflammation due to that. And certainly overstretching was something that I was doing and I had to stop. That helped, but I still had this pain. Well, someone with hypermobility syndrome or Ehlers-Danlos is more likely to have mast cell issues.
Yeah.
So implementing quercetin in my case was something that was profoundly helpful. I don't have allergies, but I'm
Yeah.
taking something that typically is thought to be helpful for allergies
Right.
for pain and
Right.
inflammation. So again, that's why it's like, well, it can be almost any kind of
Yeah.
inflammatory response.
I think this is why the functional medicine brain is so necessary, because if you go see an allergist or an immunologist, you're never going to get referred to an allergist because of pain. You know what I
Right.
mean? Like you're just,
Right.
or you could go to a pain person and they're for sure not going to be thinking about your allergies. Like, so having that sort of functional medicine approach where we're constantly thinking about all the triggers, mediators, all of
Yeah.
the things that could potentially be contributing, including the things that the person's eating, lifestyle choices, etc. So what do you do with mast cell? Obviously, how do you approach the treatment?
Well, sometimes I'll just ease in by trying things like the quercetin, the nettles, just trying to get that load down, see if the cup stops filling over. But then, the trifecta approach is very much integrative. This is not an idealistic approach. Sometimes these are really chronic issues that have lots of layers. And so being completely natural is not always the answer.
Yeah,
And
totally.
so this is where I like doing as much as I can in that regard, diet and so on, stress management, blah, blah, blah. But I do implement a histamine 1 blocker, which is things like over the counter Claritin, cetirizine or loratadine, Zyrtec, which is cetirizine, those kind of like non drowsy antihistamines, as well as a H2 blocker. In this case, it's Pepsid, and that's funny, or famotidine. A
Yeah.
lot of people are like, "Oh, I don't want an antacid." I'm like, this is where, again, focusing on digestive function is still important. We
Yes.
still do that while implementing the two angled antihistamines
Mhm.
and a mast cell blocker like quercetin. Or then if that's like maybe a little helpful and not enough, there's prescription mast cell inhibitors like cromolyn sodium.
Yeah. 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 Cromolyn has been very helpful for a lot of my patients with mast cell issues and MCAS type stuff.
Ketotifen is the other one.
Which one?
Ketotifen.
Which one is that? I've not heard of it.
Ketotifen with a K is it's compounded, unfortunately. They don't have
Oh,
it
yes,
in.
yes. Mhm.
Yeah, so but that still can be a nice tool. That's in more pill form, whereas I find cromolyn is great in liquid form.
Yeah.
Um, Interestingly, in the last year or so, we're having difficulty sourcing some of these things, given probably the demand has gone up.
Yes, I think it has.
So
Yeah,
that's where compounding
definitely.
is still our friend.
Yeah, yeah. Well, I mean, definitely. And I think the more that we understand some of these connections with long COVID and Epstein-Barr virus and so forth, where there are patients who have really been frustrated with many years of ongoing
Mhm.
symptoms and sort of that long COVID picture, sometimes this is how it looks. Not for every patient, obviously, but sometimes these can be quite helpful interventions for people. Um, okay, I feel like we ran the gamut. Any final allergy related pieces of advice or mast cell related pieces of advice?
I think the underlying factor is still going back to like this generic stress response piece. I
Yeah,
mean, when a doctor go in and they're like, manage your stress better, that's kind of like, okay, yes, I get it.
yeah.
And
But
there's a
we're
lot of
really
ins and
talking
outs
about
to
it
that.
broadly. We're not just going to say
Yeah,
it's all in your head, you know?
yeah.
Yeah,
And certainly, I think that that is still probably the underlying factor because your stress does have such a huge impact on your immune response and
absolutely.
your hormones and so on. So, just kind of leaving it at that, like, hey, that's
Mhm.
still something that functional medicine practitioners really work at
Agreed.
too.
Yeah, really controlling that inflammatory response. And then I also feel like we kind of need to give a nod to our traditional allergy practitioners. And some of the things like, not sleeping with the windows open and using allergy covers on your pillow if there's a dander thing or a dust mite thing.
Air
HEPA,
filters, yeah.
HEPA filters in the home or at least in the room where you spend
Mhm.
most of your time. Those actually, for people who do suffer from airborne related allergies, those things can be very helpful. Um,
Totally.
yeah, so we can't forget about sort of the environment in which we live. Um, and then obviously don't gather up all of those flowers and put them in your bedroom and go to sleep. Like that's just
Yeah,
not going to be a good thing to do.
yeah. Oh my gosh, and sorry, one more tangent, but,
Yeah,
like,
yeah,
with mast cell folks, I think another big, like, aha moment is when you are really, really sensitive to everything,
yeah.
supplements, even natural, or the most classic is, like, scents, right?
Yes,
So, like, candles and air fresheners and cleaners, if you're like, "I can't, I get a headache instantly," or walking into a hardware store,
yeah,
all the smells. So,
yeah,
not only is that an indicator of potential mast cell, it's also a reminder that, like, man, these environmental things, we gotta, like, chill out
yeah.
on all
Right.
chemicals.
I know the chemical load is real. I mean, there's
Yeah,
obviously natural ways, natural extracts that you can use for scents and soy-based
yeah,
candles and all kinds of healthier options. But you're right, it is overload.
yeah.
Yeah, I always feel really
Oh,
crummy when I walk through the perfume section of like a department store.
I
Oh
know,
my gosh,
I know.
I feel
Or a
so
hobby
over
store.
on the other side of it. It's like I have a headache now. I
Mhm.
need to go lay down.
Yep.
So, well, this has been very helpful. Thank you,
Yeah, that's
Dr.
fun. I
Alicia
always love
McCubbins.
nerding out with you.
Yeah, back at you. Get it? That was a cheesy
Ow.
joke. Sorry.
We're
What was
good
your
at those.
cheesy joke that you made earlier? I can't remember. You had a funny one.
My short-term memory. Oh, something, don't speak inflammatory during this talk.
That's right. Great. I know. What a couple of nerds we are.
Yeah.
Anyway, so this was great. I always appreciate your wisdom and your approach that is so comprehensive and certainly N of one patient centered. I just love that about you and all of our doctors. But you are our histamine star. So thank you so much for sharing your wisdom.
You're welcome.
Looking forward to the next time we have a chance to talk.
Me too.
All right. Thanks, Alicia.
Everybody.